Hello and welcome to the AIAMC podcast. I'm Kimberly Pierce-Burke, Executive Director, and I'm so excited today to be chatting with two of our superstar members from Cedars-Sinai Medical Center in Los Angeles, California. With me today is Nishita Jain. Dr. Jain is the Associate Program Director for the Internal Medicine Residency Program. She also serves as Assistant Professor for the Clinician Educator track at Cedars-Sinai and UCLA. Joining Dr. Jain today is Dr. Cynthia Mark, who is a senior resident of PGY3 in the internal medicine residency program there. Ladies, welcome. We're so happy to have you. And what we're going to be chatting about today is the AIAMC's National Initiative 9, which of course is on the social and moral determinants of health. We're delighted to have Cedars-Sinai represented. You're actually one of our founding members. You've been with us for all 35 years that the AIAMC has been in existence. So it's kind of cool to have that history and then to talk about something just so fresh and exciting that you've been working on. So my first question is rather obvious, but tell us a little bit about your project. I know it's on community outreach education that will empower your GME trainees. So tell us more about it and what's something that's been a highlight for you so far?
Absolutely. Kimberly, thank you so much for having us both. We're really excited to be here and talk about our project and this amazing platform that you all have created for us. So CS Core is our project. It stands for Community Outreach and Residency Engagement. It actually started a while back during the pandemic when LA was really in the heat of it. There was just it was a very critical time in Los Angeles, and we were working with different public agencies and different medical community members to really face major challenges and ensure that there was appropriate access to care and other vital resources in Los Angeles. And so as we were doing all this work, I noticed that, there are so many barriers. The health disparities were becoming more and more vivid during this time. And I was also noticing that our workforce was more burnt out. We were working harder, longer hours, and seeing more tragedy. And I think, and I saw this a lot in my own residence, and it was hard. And so during this time, we decided to create CORE, and CORE was meant to help us understand these barriers, overcome them, but also really be out in the community. And that's kind of what sets it apart is we're going out into the community, we're meeting community health leaders, we're interacting with all these multidisciplinary teams that are engaging with different agencies, and
Mm.
we're really learning about how to practice medicine outside of the hospital walls.
Mm.
And so the aim of CORE is really to equip our residents and fellows with tools to better care for the community by understanding these socioeconomic barriers that I talked about, helping our vulnerable populations, engaging with community-based programs and addressing these health disparities. And then our overarching theme being advocacy, understanding how to talk to different Congress members and such, and really help advocate for different causes. The way we structured it was these monthly didactics and workshops. We had a theme each month. This year we had really cool topics. One was justice-involved individuals and how to care for them. Another was access to care in our payer structure. Another was climate change and sustainability. We talked about mental health in our homeless population,
Mm.
along with physician wellness and burnout and how to help a struggling colleague. And then we also talked about ethical ways to practice global medicine and how to equip ourselves with the tools to go out in low resource settings to practice medicine.
Mm.
But I'd love to turn it over to Cynthia to talk about what stands out to her as she was a participant and a core leader.
Great. Thank you.
Thank
Cynthia.
Um, yeah, so one of the things that drew me to this program early on in my intern year is, as residents, we spend a lot of time talking about diagnostics, we talk about treatment algorithms, making sure, we're taking care of them from a medical aspect, but the social aspects play such an important role in their health. And I thought this was such a cool space for us to have discussions on all these important things that are impacting our populations and be connected with these amazing community health workers and that can help us to connect our patients with really valuable resources and really inspire us to, go above and beyond for our patients. So that's been really amazing.
Oh, I am loving this. Um, it's one thing to read your hospital's CHNA. What's our community health needs assessment? Or, from your resident clinics, the ethnicities, the demographics, that who's coming in. It's totally on another level to actually go out into the community and see this happening in real time. And, we know that, yes, you're right, Cynthia, as a resident, it's a lot of didactic, it's a lot of diagnostic. When you get into practice, and for you, young lady, it's just a year away. You're going to be an attending physician and have to connect your patients with all these resources that they need, and how much more seamless that's going to be for you to do because of this experience. I think it's totally, totally impressive to me. Um, we're halfway through the initiative. Our initiatives are 18 months in length. We're right about halfway. We're into a new academic year. My next question would be, how do you keep yourselves and your team members engaged? It's one thing at the beginning of it, like we're all excited and, let's brainstorm what we want to do and let's envision, start with the end in mind and all that good stuff. But you go through some stuff and then you do your assessment and then you do your methodology. And how do you keep it fresh for yourselves and your team?
Absolutely. And I think this is such a great question, and a question that's on our minds constantly. And it's a challenge. I mean, to keep our learners and honestly ourselves engaged, this work is really important. We do find a lot of passion, but things get busy, we get tired. And so it's always a challenge on how to maintain that engagement. Things that we've really talked about and thought about are really focusing on our learner buy-in. And so how we've really facilitated that is picking topics that are really relevant to our residents and our house staff and our community. And we do this simply by asking them.
What a concept.
Days, sometimes the solution is really simple. And so having that resident engagement and buy-in really offers them an opportunity to take control of their own education. I mean, they're really out on, in the front lines taking care of patients, so they know what barriers exist because they're seeing it day in, day out. And so really understanding that and allowing them to come to us to tell us, okay, we see this all the time in clinic. Can you help us with this? Why are Black women dying more often than others when they're pregnant? And, things like that, things that they've noticed in their day-to-day clinical practice. They come to us and then we try to develop content around it. And so I think having the buy-in has been really helpful for us. I think the other thing is balance. And so by balance, I mean, in the first half of the program, we had 3 or 4 sessions per month. And I think it was overwhelming for us as planners, but also overwhelming for our staff. And initially we were thinking we want to have as much depth and have as many opportunities as possible for our residents to really understand each topic. And each topic was so important. You think about the justice involved individuals and how to care for them. How can you do that in one hour session? It just doesn't feel like it's enough. But we've really noticed that having too many sessions in 1 month is overwhelming. And so having that balance, respecting our learners' time and really paring it down a little bit for the second half of our project is something we're considering doing.
Yeah, what I'm hearing there, Nishita, and I'm so impressed by is listening, asking and listening. So it seems so obvious, but yet a lot of us don't do it. I mean, we're going to have a didactic series. Well, let's do a literature review. Let's see what's in there and let's be sure we hit. Simply ask your house staff what's of most interest to you, what would be most valuable to you, and having that open door of come to us at any time, come to your faculty, come to your administration, come to us and say, something happened the other day and it's bothered me, it stuck with me. And is this something we can talk about? I mean, it's simple, but yet in our busy day-to-day lives when we're like checking items off the list, but it just sometimes that simplicity sometimes gets lost. So I really applaud you for that.
Yeah, and I just wanted to piggyback off of that answer. another thing that we've done is we actually were able to expand our program outside of internal medicine to include all of GME here at Cedars. So we've included, OBGYN residents, even our fellows. We have some Pulm Crit fellows that are involved in the program as well. And that's been really inspiring to get their perspective because they all take care of very different patient populations. So it's led to some really interesting discussions in these sessions. And additionally, I've had conversations with them where we talk, we spend a lot of time in the hospital talking about, their medical care, but then outside we've had questions of, I have this difficult social situations. Do you have any resources, or what do you guys do in this type of situation? And we were able to talk about some of the things that we did in internal medicine, what they do in OBGYN. And it was really a cool collaboration that was super inspiring.
Wow, that is super impressive. We talk a lot in our initiatives about spread and sustainment, and we think about that honestly, typically more toward the end of an effort. So the fact that you've already spread this work is really incredible and will help you sustain it. And something I hadn't thought about maybe before is the freshness that it brings to it, because you're getting those other stories, you're getting those other perspectives, and the camaraderie that must entail, amongst the specialties, I'm sure is super. It's kind of a nice icing on the cake, if you will. So I'm going to switch gears a little bit with my next question. Since we're halfway through, I'm sure, although this sounds like you all have this just perfect with the bow wrapped around it, but experience tells me maybe maybe there's a barrier or two that crossed its ugly path and something that you've had to deal with. So what I really like about the AIAMC and our work is we share everything. You could go to any conference or any group and they put their stars up on the stage and tell you how wonderful they are and this great work they did. We share what bombed. This didn't work and we think this is why, and here's what we learned from it. So I always like to ask someone, so what's a barrier and how did you work around that?
Yeah, absolutely. And I think, the way we overcome barriers, I think, is so important and part of the journey, and part of these projects. And so I think a very valuable question that you've asked. One big barrier, and it's so simple, it's probably like staring us right in the face, is because we did expand it to GME, finding a time that works for everyone is, I think, impossible, is what I've learned. And so really having, we want to maintain that engagement. We want to have our participants there, but having the ability to literally have them there has been a huge barrier for us, and one that I think is shared across a lot of projects, I'd imagine. And so one way we're trying to overcome this, and it's a work in progress, is really varying the times of our sessions. Some might happen in the morning, some might happen at noon, some might happen in the evening. And of course that allows us to get all the trainees at some point, but doesn't help us in getting everyone there all at once. So the way we want to do that for those bigger events is polling our participants and asking them, what time do you sign out? Because apparently it's different.
Yeah, I will say you're in very good company with that one, Dr. Jain. It is the number one barrier always is time. And just these are very, very busy people. And all of this is on top of, this is extra. And so one method that's helped sometimes is, instead of it being an add-on, if it's possible to have it in a time slot that's already protected time. Now, I realize when you're doing it over multiple specialties, those times may be different, but a noon conference time or a morning report, or whatever you do, or a medical education meeting, or just something that can be, they're already there anyway. But yeah, it's a universal issue, so you are in good company. So I'll just flip it a little bit for my my last question to you would be, so you've shared this great project and started in internal medicine, gone to other specialties, how you keep people motivated, some barriers you've overcome. What has inspired you? And was that a surprise? How, I guess, over the last 9 months or so working on this, what's been an inspiration to you and helped you keep that engagement?
Yeah, I can take this one. One thing that's been such a big inspiration to me is our community leaders and really hearing about their work and their accomplishments and what they've been able to do for our community around us. It's really amazing. For example, we had a speaker, Dr. Marco. He's really a big advocate for patients in long-term care facilities. He talked to us about tips on advocacy, how he became involved, and that was really inspiring. And he became involved really in the COVID-19 pandemic and helped to spearhead testing during that time for LA County. And I think what really inspired me was he told us about his efforts, and he estimated that he saved, tens to even hundreds of thousands of lives by
Oh my gosh.
talking with the governor and instituting these different programs to protect these patients in long-term care facilities. And that was just so inspiring to hear how his work had really resulted in really good outcomes for a lot of these patients. And another example, we got to do a community ride-along down at Skid Row with the Department of Public Health. And it was something I didn't realize, but they really described how much of a community these patients have, or this population has.
Mm.
How sometimes when we think about housing, taking them out of this community and moving them to another location can really be disruptive for them. So they are working on initiatives to help them, sustain housing, but within their community so they can have both of these support systems to really be successful. And just seeing how these community leaders really tackle these problems and work with these populations to come up with sustainable solutions, it's really inspiring.
Wow, it inspires me just hearing about it, and it's secondhand, not firsthand like you. That is really wonderful. And again, as I said at the top, getting these residents out, getting the learners out into the community, I think is just so special, because you may not have met that gentleman and you may not have known his story, and it's the power of one. And we talk a lot about teams, we talk a lot about systems, and it's very important, don't get me wrong, but sometimes we need to be reminded that I can make a difference, and knowing again where to connect the dots in the community to make that happen is just so important. So I'm sorry our time's gone so fast. I could continue talking, but I do want to thank you again, and we hope those who are listening will subscribe to our YouTube channel. You can also follow the AIAMC on social. We're on them all. We're on LinkedIn, Facebook, Instagram, Twitter. So my sincere thanks to Dr. Jain, to Dr. Mark for joining us today. And I thank each of you who are listening in, and we look forward to being with you next time. Thank you.
Thank you so
for
much.
having us.